Hello, 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 YouTube world. This is Miss Patty with For Your CNA, and we're here for our weekly live question and answer session where I answer all of your questions on CNA training, testing, workplace, and whatever else you got. We're here to help support you. So today is Thursday, May 12th. Before we get started, when you guys come in, just let me know. Hey, Gloria, I see you. Hi. Just let me know that you're here. Send me a quick hi in the chat or a wave or a thumbs up or something. And as always, I start out with a little mini lesson on a topic usually that you ask about. And today, I believe it was Jennifer asked about Medtech. So I did a ton of research on this because medtech is one of those things that it's not as easy to say, like CNA is standardized across all states. So a CNA in Wisconsin, a CNA in New York, a CNA in Florida, a CNA in Texas, they can all do the same tasks because the legislation across all states is standardized. It actually comes from the federal level. So when we talk about CNAs, LPNs, RNs, those are all very standardized. MedTech is not. And MedTech is one of those things that's probably as unstandardized as you can get. So I went through and actually looked up 6 or 7 different states today. And to find out, I went into the statutes, I went to the boards of nursing and the other regulatory agencies and tried to get a good overview of just a couple of states and how different medication assistants are in these states. Now, please remember, I did not cover all 50 states. I unfortunately just did not have that kind of time. I mean, that's like a 3-month project. Okay. So this is just a very brief overview to show you just how different these types of unregulated entities can be state to state. Hey, Fred. Hi, Emily. Thanks for joining us. Hi, Mumina. Veronica. Hi. Okay, so the first thing that we have to talk about when it comes to MedTech is that there's a ton of names. Hey, Jennifer, this is all for you. There's a ton of names out there. Okay, so some people will call it a MedTech, and that's usually what it's called in Florida. But other states have medication assistant, med aid, medication aid, qualified medication aid, MAC, which is medication aid certified. So there's a ton of different names here. And not all of them are regulated at the state level either. For instance, in Florida, there is no state designation. There's no registry. There's no single entity that regulates all of that. But in most other states, there is. There's an actual registry that a medication aid is put on. Some states require that you are a CNA. Some states require that you're not just a CNA, but you have a certain number of hours as a CNA before you can be a med tech. Some places let you take a class and then get a job. Other places require that you get a job and work there for a while and then take the med tech training to only work with those specific patients. So it's like all over the place out there. And it's so confusing to students because you may have somebody who's been working as a med tech in Texas and then moves to Tennessee and says, okay, well, I've been a med tech in Texas, shouldn't be that hard. And they find out that Tennessee is completely different. And for the most part, medtech certifications do not cross state lines. So if you go to Tennessee, they're not going to say, oh, yeah, no problem. You've been a medtech in Texas. We'll give you one here too. Doesn't work like that. You would have to get certified in Tennessee. And for the most part, that means going through their training again and meet their qualifications. So it's like all over the place when it comes to medtech. And that's why it's really, really hard when somebody asked me about that, can you tell me a little bit about medtech? I said, okay, that's going to have to wait till a whole different opportunity because there's just so much out there. So let's start out with Oklahoma, because Oklahoma is probably one of the most confusing states when it comes to medtech. But okay, it's confusing, but it's actually laid out very logically. Although at first glance, Oklahoma is like, oh my gosh, what is this? Once you dig into it, you're like, oh wow, it's actually very regimented, and I really kind of like that. So in Oklahoma, it's called CMA, or Certified Medication Aid. Okay, so CMA. But you have four different designators of CMAs. So you have just a CMA, then you have a CMA GM, which means that you are certified in glucose monitoring. You have certified CMA IA, which is a certified medication assistant who has been trained to administer insulin. And then you have a CMA RG, which allows you to give medications through different routes, like respiratory, some gastrointestinal, which would I'm assuming include peg tubes or feeding tubes, that type of thing. So in order to be a med tech in Oklahoma, just the starting out CMA in Oklahoma, it requires 6 months experience as an RN, and the training is 50 hours. So you have to go to school for 50 hours, and that's just for your basic CMA. If you want those other designators, that would require a couple of hours more education for each one. So although it's a little bit confusing at first glance, I really like how they're detailed with it. So there's no confusion over what the med tech or medication assistance or CMA can actually do. Okay. So I really kind of like that. Other states, not so much. So here in Florida, we're kind of like the Wild West, right? Remember Oklahoma? I said you had to have 50 hours of training. That's just for the base. Well, here in Florida, it's only 6 hours. You don't have to be a CNA at all to attend the training. So anybody can just go take a 6-hour class, and now they're qualified to pass medications in certain settings. It's not regulated by any industry. AHCA, which is the Agency for Healthcare Administration, actually oversees the training, sets the training standards, but there's no agency that oversees who actually is a medication assistant. You simply find a place, you go take the class, you get a certificate. Congratulations, you can now work as a med tech. And in Florida, I use that term med tech, but in Florida, that's not actually a recognized designator. It's what everybody calls it, but it's not a recognized designator. So like in the state statutes, you'll find CNA, but you won't find med tech because it's not recognized by the legislature or the Florida administrative code or anything like that. It's just kind of a we know it by type name. So Florida is completely different. We don't require anything. You take a 6-hour class. Congratulations, you can help people with medications, and there's no oversight. So we're kind of like the Wild West here. Now, compare that to, all right, Indiana. Now, Indiana calls it a QMA, which is Qualified Medication Assistant or aid. I'm sorry. They require 100 hours of training, and you can't even take the class until you've been a CNA and worked for at least 1,000 hours. Now, a lot of you are like, "What, 1,000 hours? Oh my gosh, that's a huge amount of time." But really, it only works out to 6.5 weeks or 6.25 weeks of full-time CNA. Okay. So 1,000 hours sounds like a lot, but it's really not. It's less than 2 months of working as a CNA. But if you think that's strong, who was it? Hold on, let me just scroll down here. Wisconsin requires 2,000 hours of experience as a CNA, and you already have to be working with the patients that you're going to be administering medications to. So you're only allowed to get the med tech for the place that you're working. So yeah, wow, it's just like all over the place, right? And then you've got North Carolina, which is like kind of strange to me. So North Carolina, you start out with a 5-hour class. So it's pretty close to Florida and a 6-hour class. So you start out with a 5-hour class in North Carolina, but within a certain amount of time, you have to follow up with a 10-hour class. So it's a total of 15 hours, but it's in 2 separate parts. 5 hours first, a period of time, and then a 10-hour class. Now they did approve a 15-hour class out of the gate to get it all over and done with. But there's a setup a little bit different in North Carolina. 10 hours of that training is in a classroom, 5 hours is in clinical. And you have to be a CNA and you have to show competency of vital signs before you can even take the class. So a little bit more complex. And then you've got Tennessee. Now, Tennessee calls it a MAC, M-A-C, which is Medication Aid Certified. Okay. It requires 1 year experience as a CNA. So you can't just kind of get it right out of the gate. You have to have a year experience as a CNA. But in Tennessee, you can actually work in nursing homes as a CNA. Other states like Florida, we don't allow you to work in nursing homes. You can only work in assisted living or home care or adult family care homes, that type of thing. But we don't use medtechs in nursing homes. Now, that is going to be changing here very, very shortly. And I imagine the medication training will have to change to offset that. But some states do allow medications to be administered by unlicensed individuals in nursing homes as long as you meet the criteria. I have mixed feelings about that. As long as they're routine meds and all you're doing is opening the bottle, giving the medication, documenting, that's okay. But in nursing facilities, the whole reason they're there is because they require nursing care, nursing assessment, which means things are changing with the patient pretty rapidly. So I kind of think that we're missing some assessment opportunities there by having unlicensed people, but I'm not the one that writes the rules. And we have a nursing shortage, and I understand why they're doing this. Texas requires 120 hours. And you have to be a CNA, and they can work in nursing homes too. So you've got like, it's all over the place, right? You've got everything from 5 hours all the way up to, there's one that's almost 200 hours of education. So you've got everything in between. And that's why it doesn't easily transfer over state lines. Some states you're allowed to give nebulizers, other states you're not. Some states you're allowed to help with inhalers, other states you can't. Some states you can check blood glucose, other states you can't. So because it's not standardized, I mean, the name isn't even standardized. So because it's not standardized, it doesn't easily translate. But all of that aside, what do medtechs or med aids or MACs actually do? Well, they're there to assist patients with taking medications that are routine. Same thing every time or every day, right? I take this pill at this time, this route. Okay, so we're opening bottles, we're dispensing the right medication, we're giving it at the right time, the right way, we're documenting that it was given, but there's no thought process here. It is just read the order, do the tasks, document it was done. No judgment at all. That's really what a med tech does. Now, some med techs have to be CNAs, so they can work in patient care and help with medications. Some places don't allow their med techs to do patient care. It's only medications. So every facility is going to be structured a little bit different too. But medication assistants, that's really their job, is to help patients take routine medications that do not require any judgment at all. And if they can't, if the dosage isn't right in the bottle that matches the order, or the patient is not able to take it like they normally can, then the medtech's job stops, and then we have to get a nurse to take over from there. But that's really what a medtech is designed to do. I hope that kind of helps you guys understand a little bit about what medtechs are and how they're not really overly regulated, and how the training and work requirements are going to be different in every single state. Now, on top of all that, because that's complex enough, right? Florida has a different type of med tech as well that's only allowed to be used in working with developmentally disabled individuals. Now, that's also a 6-hour class, but they're going to learn how to do tube feedings as well. So in Florida, when you use a term med tech, you actually have to indicate whether it's geriatric population or developmentally disabled population, because the training requirements are actually a little bit different and overseen by 2 different agencies. So that makes it even more complex, and they don't cross. So you can't get training in one and use it in the other setting. They don't cross. So kind of strange. Gloria says she can't hear me. Can everybody else hear me? Can you guys hear me? Can you let me know if you can hear me? Thumbs up or something? Anything? Can you hear me? Well, while I'm waiting to hear from you, I'm going to say hi to everybody. So Efua, okay, Denise, thank you. Efua says hi. Emily, hi. Denise, hi. Welcome back. Jennifer asks, is a CNA licensed or certified? Oh, thank you, guys. I appreciate it. Someone told me that each state is different on that. Jennifer, absolutely. Yes, there are 1 or 2 states that do call them licensed. That is not the accepted term. There's a difference between licensed and certified on a legal level. And I know for us, it's just a word. What is the difference? It sounds similar. So what's the difference? Thank you, guys. So the main difference is licensed means liability. Just remember those 2 go together. Licensed means liability. So if you're licensed, it means that you have the ability to assess a situation, make judgments, and be held accountable for your actions. CNAs are generally not trained to assess. That is not a CNA task. You just don't have enough experience or education or training to be able to do that effectively. So because you can't assess, you can't make judgments. Because you can't make judgments, you're not held accountable for your actions, which means the licensed individual who's doing all that and telling you what to do is the one that's going to be liable. So licensed means liable. That's why nurses and doctors are licensed, but CNAs are certified. There are a couple of states, though, that do use that term licensed for nursing assistants. I'm not real sure. I'm sure that they spell it out in their state statutes, the limitation of liability, but I haven't researched it to that extent. But remember, from a legal standpoint, I'm just talking about legal right now. Licensed means liability, because licensed means you have that additional training for assessment, decision making, or judgment, and then being held accountable. So accountability. I hope that kind of helps you. But yeah, you will see that licensed nursing assistant. Alina says, I'm studying for the CNA board using your videos as a guide. Thank you. Well, thank you, Alina. We wish you lots of luck. Good vibes out to you. Jennifer says, do you know exactly what radiology is and what a CNA would do on a radiology unit? Well, again, that term is a little ambiguous. When you're talking radiology, most of us think of a radiology department where you get radiation therapy, where we do CAT scans and MRIs, where we do radiation guide or CT guided biopsies and aspirations and things like that. So yes, CNAs can work in radiography is the term. and anywhere a nurse can work, a CNA can work. So yeah, you can. You can. But radiation can also be a unit in a hospital. So especially like cancer hospitals, and these would be people that have radioactive elements implanted in them to be able to kill off the cancer cells. And so they are in very limited amounts emitting radioactive waves. So, yes, CNAs can work in those settings as well. And it really depends on the type of work you're going to be doing. But, patients that are in a hospital, they need personal care. They need somebody to help them brush their teeth or comb their hair or bathe or whatever. So, yes, CNAs can work there. In a radiography department, you may be helping patients get positioned, helping them prep, helping them check out. I mean, there's a lot of different things that you might be doing in that setting. It really depends on what their needs are, but yes, there are opportunities there. Let's see. I was talking about radiology in a hospital in a unit. Yeah, yes, there are opportunities there, absolutely, because personal care still needs to be done, and we also often those that are receiving radiation therapy, either implanted or external, we generally separate them out from other patient populations as well. So yeah, you definitely can work in those types of settings. Peace. Peace's exam is on Monday. Oh, how exciting. I know you've been with us for a long time. We're going to send you lots of good vibes and hope that you do fantastic. Just remember, never choose an answer on a written test that treats an adult like a child. We are not there to force or make or discipline any adult. Not the right answer. If you remember that, you'll be okay. Denise says, hey, Miss Patty, I'm a CNA thinking about geriatric nursing. Can you speak a bit on that? Sure. Geriatrics just means care of the elderly. And that is the biggest segment of CNA work, right? Most of our jobs out there are going to be involved in care of the elderly. And that's just what the term geriatric means. So you'll have, geriatric CNA work in homes and assisted living and nursing homes and hospitals and everywhere else, because it's the biggest patient population. You have to understand that adults, older adults, elderly people are different from younger adults. They're just different. Their skin is way thinner. They've lost the subcutaneous fat, so they're going to be a lot colder. But they're also going to be more aware of temperature changes. Like if you use water and you think it's comfortable and they feel it, it may feel completely wrong to them because they don't have that same layer of subcutaneous fat that's blocking their nerve endings from the water that they're feeling. So they're going to feel temperature much more acutely than you do. They also are going to get tired a lot quicker. So we have to think about energy conservation. They may have sensory deprivation. They may have limited eyesight or difficulty hearing. They may not be able to speak well because of dental issues, or they may have a cognitive decline. So there's a lot of different changes that go along with aging. And when you're working with the geriatric population, you need to be aware of all of those so that you can modify your care based on the needs of the patient. I hope that helps. Peace says, what is the standard blood pressure for systolic and diastolic? Okay, Peace. The top number, or systolic, is 100 to 119 is the top number. They changed the standards on me a couple of years ago. I always have to think about it now. So 100 to 119 for normal on the top number. 60 to 79 is normal on the diastolic or bottom number. Okay. So bonjour. Carrie Ann says, I was graduated from August CNA, get a date for December. They canceled it. Still calling for a date. Need studying tips, please, and thanks. Wow, Carrie Ann, that's horrible that you're waiting that long to test. Stay on top of that. Be persistent. Squeaky wheel gets the oil for sure. So be persistent. Keep calling. Try to get that test date established. But studying tips, when we're talking about the written test, there's 5 main things they're going to be grading you on the written test. Resident rights, which we just talked about. Don't treat an adult like a child. You need to know your role. Remember, CNAs don't think. We don't use judgment. We follow the care plan. If we can't follow the care plan, we tell the nurse. It's that simple. So we need to understand our role, because you're going to have a lot of questions on the role of the CNA. Make sure you truly understand that. We also, sorry, I was just reading what Jennifer says. So resident rights, know your role. Infection control, you need to understand infection control. Know your normals, and we just kind of covered this, right? So normal vital signs, which I just gave you, but also normal for aging, which I also just gave you, right? So know your normals. What's normal for aging population, what's normal for vital signs. And then you have, let's see here, I lost my train of thought here. Resident rights. I've got, here we go. I have my little cheat sheet here. See my little cheat sheet? Resident rights, know your role. Infection control, know your normals, and safety. Safety is going to be a big topic on the state exam. So you have to make sure you understand safety. And one of those things that they're going to ask you about is fire safety. So make sure you know RACE. Rescue, alarm, contain, and extinguish. We always move patients out of the way. If there's a fire, you never want a patient and a fire in the same room together ever. So we got to get those patients out of the way. Then we got to let somebody know, hey, there's fire, so pull the alarm, whatever your facility policy is. And then we want to close the door because we don't want that fire going anywhere. So we want to close the door. And then if you can and you feel safe and you know how, you can try to extinguish it. But make sure you do those other 3 things first. Never just go straight for the extinguisher and try to put it out. So safety is going to be big on the state exam. Okay. Hope that helps. So that's the written test. Now the skills, that's all of my principles that I teach. So if you want a refresher, go onto my website, foryourcna.com. You guys all know this now. The number 4, YOURCNA.com. Under CNA training, the menu at the top, the very first menu option, under CNA training, watch the skills videos and then watch the animated lessons. Both of those are important. Everybody gets stuck on the skills. They want to see how, and the skills show you how. The problem is that you also need to know the why behind the how. And those skills videos aren't going to show you that. That's what those animated lessons are for. So make sure you're watching both, because if you're not, you're only getting half the picture. So watch both of those skills videos, animated lessons. If you do that, you'll do great. We also have a practice test on there that's free. Take the practice test. It'll give you a good idea of how you're going to do on the state exam. Okay. All that's free on my website. Let's see, Jennifer. Yeah, 120/80. And that's, nobody is ever like, how do I put this? Normal has to be a range because people are different. And even you yourself are going to vary throughout the day. It's not like one number and that's where you stay forever and always. Everybody knows this when they stand on a scale, right? If you stand on a scale in the morning and you stand on a scale at the evening, same scale, same use, same everything, and the number's still going to be a little bit different. And that's because, your fluid levels change throughout the day. What you eat changes throughout the day. I mean, there's so many variables there, right? So it'll be off by a few ounces, maybe even a pound or 2, depending on your personal situation and whether you just had a huge cheeseburger, right? So numbers, when it comes to measuring things in healthcare, it always has to be given in a range because people are in constant states of change. But it's not just me individually, it's everybody. So we have to have a range. And that's why it's 100 to 119 for the top number, 60 to 79 for the bottom number. But if you kind of cap that off, right, that's one, it ends at 120 and 80, right? So anything under 120 over 80 is now considered normal. It used to be years ago when I first started, it was 100 to 139. I mean, we actually cut that normal level in half, gave millions of people high blood pressure overnight, literally. But they have now found that, if you're over 120, you are at risk for some of the long-term health effects that high blood pressure causes. And we want to identify that earlier rather than waiting until those issues are already there. That's why they lowered it so basically you want to be under that 120 over 80 mark. That way we can find the problems early. And Alina says, any advice for those like me trying to learn the skills? Don't forget the procedure of the skills. Yeah, Alina, watch my animated videos, because when you understand the why, the how makes sense. So go watch those animated videos. Those will help you a ton. I promise you they will. Makayan, hi. Thanks for coming. He says, I paid for the Prometric practice test, but I couldn't access the test until I got an email saying that the test was canceled. I didn't even receive a refund. I called and was left on hold. I am so sorry, Peace. Yeah, Prometric is not the easiest company in the world to deal with. I will be absolutely honest with you. They're just not. I thought their practice test was $10. So maybe it's gone up. I don't know. I haven't checked in a very long time. But I'm wondering if maybe you actually signed up for the written test in your state at 35. I'm not sure. But call Prometric. Keep calling Prometric until you get through to them. With Prometric, persistence is key. They are not the easiest company to deal with. I wish they were. I wish I had good tips on how to deal with Prometric. I haven't figured that out yet, and I've been dealing with them for 15 years. So good luck. Good luck. Just be persistent. All right, guys. So do you guys have any other questions for me today? I know we've covered a lot of info. Any questions? You're welcome, Peace. All right. So one of the things that came up in the last couple of weeks was, what is the role of the RN in all of this? And I want to kind of direct you back to what we talked about just a few minutes ago with the Medtech. Remember, I said that licensed individuals assess, they use judgment and develop a plan, and then they're held liable for the outcomes, right? That's really what an RN does. And that's why the RN kind of directs everybody else. If I've got a patient that comes into my facility and I've got to figure out what needs to be done with this patient, I'm going to do an assessment. Now, this is head to toe. This is real problems. This is potential problems. This is anything that might come up, but it's also things that I need to watch for as well. Maybe his lab values. Maybe he's having radiation therapy, and I need to watch for skin changes, nausea, vomiting, effects on organs that are in the path of the radiation that he's receiving. I need to think about comfort measures. I need to think about the utensils he's going to use, because sometimes metal or plastic can have an effect. So I mean, there's so many things that I have to consider with this patient. And if I'm working with multiple patients and I've got all of these things to consider with all of those patients, I'm not going to have time to help them onto the bedside commode, or to walk them down the hallway, or to help them brush their teeth when I'm working on all these other higher level tasks as well. And that's why I need helpers. So that's where the CNA comes in, is the CNA is there to be a helper for me. I'm going to plan all the care. I'm going to decide what needs to be done, what needs to be monitored, what we're going to do. And then I need some helpers to help me carry that out. But my helpers aren't helping if they're not doing it the way I need it done. And that's what that care plan is all about. And you hear me talk about the care plan a lot. But the care plan is the one thing that's keeping us all on the same track. Because otherwise, you may have an idea and go way off in left field, and you may be doing something completely different with the patient than what I need done. So the care plan is there to keep everybody on the same track. And that's why you can't vary from that care plan. So in CNA world, CNAs only have two options. You follow the care plan or you notify the nurse. That's it. That's it. There is no door three. There is no all of the above. It's either follow the care plan or notify the nurse. That's it. So the written test is not that hard, because if you remember that we follow the care plan or we notify the nurse, remember, you're not making judgments. You never make decisions. Now, you do have to know basic nursing care, right? You do have to know how to do all those tasks that the care plan tells you to do. And that's where that training comes in. And that's where those skills videos and animated videos are going to help you. But for the most part, CNAs are trained to do these tasks. We're going to do them exactly the way the care plan tells us to. And the facility policies and procedures are going to dictate how the facility, kind of abroad, how the facility wants things done. For instance, in training, you probably were taught to give a partial bed bath using soap and water and a basin and towels and washcloths and things like that. But when you go to work at a hospital, the hospital may have you give a partial bed bath with these wipes that are kept in a warmer. So the policy and procedure is going to tell you the facility way of doing things. The care plan would take that a step further. So let's say we're in a hospital. I ask you to give a partial bed bath. You're going to be using the wipes, but I'm going to give you some very specific information. I do not want you to use the wipe on the right side of the patient from armpit to waist, that whole side of the patient. Don't clean that with the wipe. Okay. So that would be the care plan. So the policy and procedures are going to tell us how to do things in a facility. The care plan is going to modify that for this specific patient. And your training is what's going to help you identify how to get these things done. I hope that helps. Peace says, I watched the card video, but I didn't understand it. I'm sorry, Peace. I do apologize for that. If you need some additional help, just email me and I can help you with that. Letitia says, hi, Patty. Did you talk about medication aid and hospice? Yes. Well, Letitia, I did not talk about hospice. I did talk about medication aid. We spent probably 20 minutes of that on that at the beginning of this session. So go back and watch that once I put the replay up. But I didn't talk about hospice and medication aids. And again, it's going to depend on the state. Remember I said, though, and this is universal, right? Medication aids or medtechs or medication assistants or MACs or whatever you want to call them, right? They are there to give routine meds to stable patients that require no judgment, right? So these are stable patients. So you take an aspirin a day, I can help you with that. You take a Lasix a day, I can help you with that. You take, a cholesterol pill, I can help you with that. That all routine meds are given at the same time every day. Nothing ever changes. In hospice, though, for the most part, your patients, they may still be taking those routine meds, right? An aspirin a day, cholesterol med, blood pressure, whatever. They may still be taking that. But hospice is going to add a new level of complexity to that, because now we're going to be giving medications to control symptoms. If you have a lot of anxiety, you need an anxiety med. If you have a lot of pain, you need a pain med. If you have a lot of muscle cramps, you need a med for that. So we have to medicate for symptoms that come up. We're trying to keep the patient comfortable. So those are going to require judgment. So when it comes to medications and hospice, medication aids in some states, not all, some states may be able to give the routine meds, the aspirin, the cholesterol, the blood pressure, same meds every day, same time, but they're not going to be able to help with those other medications that help control symptoms because they are going to require judgment, which we can't do. Hope that helps. So let's see here. Do again, assistant. Did I miss one here? Assisted living is not considered skilled, even though they take vitals. Do they have to be ambulatory to be in assisted living? I'm still kind of unclear what assisted living is. Okay, Jennifer, I will cover that in detail next week. I'll make a note. Okay, what assisted living is. But we've kind of covered this in the past, and I'll go over it again next week, no problem. We've kind of covered this in the past. You have to separate out personal care from nursing, okay? Personal care is not nursing. Personal care is things you do for yourself every day: bathing, dressing, grooming, feeding, toileting, movement. Those are personal care, things you do for yourself every single day. Nursing are things that are designed to monitor a patient or improve their health. Okay. And a lot of that is going to encompass observation and reporting. So CNAs are trained while they're doing these personal care tasks to watch and listen and feel, and anything they notice needs to be reported to the nurse. Okay, so personal care is different from nursing care. Different. CNAs can do personal care and nursing. So think of CNAs as being able to do both. While they're doing personal care, they're going to add on observation and reporting. Does a patient need to be ambulatory for assisted living? No, because assisted living is personal care. Bathing, dressing, grooming, feeding, mobility, toileting, all of that is assisted living. It doesn't matter whether the patient can get up and down. That's irrelevant. Those are still personal care tasks. Now, vital signs are not personal care. Vital signs are nursing, but assisted living can offer vital signs if they have a CNA or a nurse that is taking them, or that is overseeing trained people that are taking them. But a patient in assisted living must need help with personal care: bathing, dressing, grooming, feeding, toileting, mobility. They need help with personal care. They may need a little help with personal care. They may need all help with personal care. But the thing is, they're stable. There's no nursing involved there. It's all personal care. But I'll get into that a little bit more next week, okay? Richard says, I'll be doing my skills test tomorrow after watching your videos for some time now. I'm pretty sure that I'll pass. Congratulations, Richard. Good vibes out to you. Let us know how you do. We're going to be thinking about you tomorrow as you're taking your test. Let's see here. Next week. All the best. Thanks so much. Welcome. Can you please repeat what your website is? Okay, Alina, my website is foryourcna.com. It's the number 4, just like what you see back here. Your CNA. I know it's backwards, but foryourcna.com. The number 4. And yeah, Jennifer, I kind of had to I figured it was nursing, not bursting. Let's see here. Merlene says, if I fail the clinical skill, what state will the state give me the same skills again? Usually no. Sometimes yes. And sometimes you can have one skill that is repeated on your next attempt, but usually it's not the same 3 skills or 5 skills if you're at a 5 skill state. Okay, I think that's good enough. You don't have to go over it next week unless you want to. Thank you. No problem. Helen says hello. And yes, Jennifer, people in assisted living aren't sick. They just need help. Could you please mention your email? Peace, just go onto my website, foryourcna.com, click on the contact us and send me the your question through the contact form. That goes straight to my email. It's the best way to contact me. All right, guys, it is that time again. I have to leave you again this week. I'm so sorry, but stop in next week. I'm not real sure what we're going to talk about. I will come up with something, I'm sure, between now and then. If you've got any topics, feel free to give them through my contact form. If you've got anything that you want me to focus on, go to my website, foryourcna.com. Click on contact me at the top and send me your ideas and I'll work them into a show. Other than that, I hope you guys have a fantastic week. Those of you that are testing this week, best of luck to you. We know you're going to do fantastic. Go watch the skills videos and animated videos and you'll be fine. I want to appreciate Nadesha Clayton for passing the state exam and stopping by our channel to let us know that they passed the state exam. So congratulations to you. And you guys that are testing, please make sure that you come back and let us know how you do so we can congratulate you as well. So until next time, guys, I will wish you happy caregiving. Have a fantastic weekend. And I'll see you guys all back here next Thursday at 3 on our YouTube channel. Talk to you later. Bye.